We've had a Big Dan Murphy's going into a very poor neighbourhood in Cranbourne in Victoria. The community didn't really want it, the council really didn't want it, and the police didn't want it, and they put together a very strong case, and they were sort of trounced in the hearing. So there's really good evidence that liquor licensing is an important determinant of community rates of harm from alcohol, from things like violence, family violence, and general health. The density of liquor outlets and the hours at which they're allowed to operate are kind of key drivers of what happens in communities on these issues. So getting involved in licensing processes is a key way for communities to sort of manage their well-being in this space. The local community is kind of the key driver of these decisions on a case-by-case basis, and people in the community know the problems of the community, and they know the kind of the things that the risks for a community, and so they need to be kind of the key voices in making objections where there's an inappropriate development, or in managing the kind of potential damage that new outlets can have. We see quite clear evidence that as you change the density of outlets in a neighbourhood over time, you see these sort of corresponding changes in acute harms like public violence and family violence, and even unintentional injury, so falls and other kinds of accidents, are all pretty well established as being linked to the number of pubs and bars in a neighbourhood and the number of bottle shops. So this is a key concern both in terms of the on-premise drinking venues and the bottle shops, and the harms that are affected are quite broad. There's growing evidence that communities where more and more, particularly packaged liquor outlets, bottle shops are opened, you do see sort of longer term shifts in rates of chronic disease that's linked to alcohol, so things like liver disease particularly. It's still to be sort of determined how strong that relationship is, but it's a kind of worrying sign that we're going to see changes. As we kind of keep deregulating liquor markets, we're going to see changes not just in these acute problems, but also over the longer term in sort of chronic disease. We're building an evidence base on the kind of differential effects of alcohol outlets in different types of communities. I've shown in Victoria that with bottle shops, we've found much more of an effect when bottle shops are added to disadvantaged neighbourhoods in the suburbs. So adding a bottle shop into a kind of inner city neighbourhood has much less of an impact on things like family violence than adding it into a neighbourhood that's 15 kilometres from the city and socioeconomically disadvantaged. There's some quite distinct variation in effects that are kind of key concerns when you're thinking about, well, is this new proposal likely to cause more problems or not? The whole process can be quite frustrating, and the industry is quite well resourced to make these sort of slightly spurious arguments using convincing lawyers and convincing consultants. It's frustrating. I mean, the evidence is quite clear, especially around packaged liquor, say, that adding an outlet to an area of high disadvantage is quite problematic, and the sophisticated arguments that they try and put together to refute that are really just to defend their own corporate interests. So if you're a inner city entertainment precinct, then adding another big late trading pub is probably likely to lead to more problems on the streets, more of the kind of acute street violence and injury and those kinds of issues. But if you're a kind of suburban community, I think packaged liquor is a kind of key driver of a range of harms, family violence, chronic disease and general violence, and that's often not thought about when these applications go through. It's less obvious to the community that this is a risk rather than the big noisy pub, which is kind of obviously going to have some impact. We've developed this kind of broad evidence base of the overarching impacts at the kind of population level, which is very helpful, but then you need to put together kind of a local case on the rates of harms in your community and whether they're going up or down, the existing density of outlets and whether they're above or below state averages, and try and kind of build, because no one's arguing that there should be no more licenses anywhere in the state, but trying to figure out what are the particular risks in this community and are they worthy of making an objection here. I've always been interested in how to apply my sort of technical skills to community problems, using statistics and mathematical modelling to understand and help prevent harms in communities, and alcohol seems to me to be a kind of one of the key issues that in Australia we don't handle very well. We're on top of tobacco, we're doing well on road traffic, but alcohol continues to be this kind of major public health problem that we need to build up more evidence. And so my work was focused on trying to understand, well, how can communities intervene better? What kind of evidence is needed? And it turns out that if you get involved in the licensing process and you can manage the number of pubs and bars in your neighbourhood, you can have a real impact on public health quite broadly.